Welcome to Something Positive for Positive People. I'm Courtney Brain. Today I have a doctor with me. Yay! So for the first time on here, I have a legit medical professional who's going to be able to talk us through some of the things that he sees here. I've got Dr. Matt Bruckel with Total Access Urgent Care here in St. Louis. Dr. Bruckel, you want me to call you Dr. Bruckel? Can I call you Matt? Like how do we go through this?
If you're going to be my patient, you should call me Dr. Bruckel. If we're meeting socially, then Matt works perfectly.
All right, I'll just call you Dr. Matt out of respect.
I love that. Sounds good.
So, Dr. Matt, how long? Well, tell us a little bit about yourself, your education background, what you do here at Total Access Urgent Care, besides own the place.
Yeah, sounds good. So, I went to medical school here in St. Louis at Washington University. I finished medical school last millennium in 1997. So I'm a WUMS 97. I was chief resident at University of Maryland in Baltimore in emergency medicine and finished that in the year 2000. And I'm a board certified emergency medicine physician, and I've worked in the field for 20 plus years. Currently, I work at Total Access Urgent Care. I'm the founder and president of Total Access Urgent Care, and we are excited for the services that we're providing here in St. Louis. We're looking to change the landscape of healthcare in St. Louis and make it better for everyone.
That's awesome. That's awesome. And how long? Well, not how long. How many locations do you guys have here?
Yeah, currently we have 17. We're in a growth phase, and by the end of 2018, we should be at 25 locations.
Oh wow, that's awesome. So, what do you guys? What makes you stand out?
So my reason for starting Total Access occurred in my experiences in the emergency department. Nobody likes going to the ER, and they don't like going to the ER for several reasons. It takes too long, it costs too much, it's too complicated, and then they're mean to you.
Yeah, definitely. I've heard that one before.
So it doesn't have to be that way, and I tried to fix many different ERs in my 20-year career, and didn't do such a good job at being able to fix the ER. So I figured that the way to solve the problem was to start my own office, and it's called Total Access Urgent Care, and we perform most of the services of the ER, and we perform it in a fast, friendly, and affordable way. That changes the dynamic in healthcare in St. Louis. So, for instance, some of the services that we perform at Total Access that we also perform in the ER are cost 1/10 as much. So 10 cents on the dollar for the same exact test, same exact service. So it doesn't have to be difficult. It doesn't have to be expensive. It can be easy, straightforward, and we only hire staff that are nice to our patients.
Oh yeah, kindness is definitely something that you guys are known for. I've spoken with Ashley here, who I forget her position. What's Ashley's position?
She's the director of marketing and the patient experience.
Oh yeah, okay. So when we were talking, she was telling me that kindness from the receptionist, the people up front, whenever they greet a patient coming in, is very, very important to them. So she's
Correct.
on them about that, and it reflects in you guys' reviews. You guys got a lot of 5-star ratings. So
right. That's what we aim to do. We aim to please. We're
Awesome.
here to make patients' lives better and not make their bad day worse.
Okay, so the reason that I wanted to sit down with you and talk today is because we live in St. Louis, Missouri, the STD capital of the world, last I checked. And what I wanted to do is just kind of get your perspective. I haven't had any medical professional, well, I've had medical professionals on, but not a doctor. These were people who are in the research field. But I wanted to get the perspective of what you see being on the other side of this. So I would be considered, I'm the patient perspective, considering I have herpes, and now that I've had it for 6 years now, I have a lot of questions that in hindsight I would have been able to benefit from had I gone back and been able to, knowing what I know now, be able to have these questions to ask upon my own diagnosis. So first, let's just get started with the most common question that I get from people. That's terrible. All right, Dr. Matt, so tell us, what is herpes?
So herpes is a clinical disease that's caused by a herpes virus. So herpes virus is an infection, small little, tiny little virus that you can't see. that causes a cluster of painful sores on your body. So oral labial herpes causes sores just right around your lips, and genital herpes typically causes genital sores in your privates.
Okay. And who typically gets herpes?
Anyone can get herpes, but it becomes much more common in sexually adults of sexual maturity. So teenagers, young adults are the largest group of patients who are getting new infections with herpes. But obviously, once you have herpes forever. So you have older people that have herpes as well. They just didn't contract it recently.
Okay. And how common is herpes?
Very common. So most people have been exposed to herpes at some point in their life. When we talk about oral labial herpes, so HSV, herpes simplex virus type 1 infections that are sores around the mouth, somewhere between 50 and 80% of all people, including kids, are positive for HSV type 1. When it comes to genital herpes, which is more commonly what's called herpes simplex virus type 2, about 1 in 6 people have genital herpes, and there's about 3 million new cases per year. So about 1% of the population is diagnosed with genital herpes every year.
Yeah. And so my question about this is, well, are cold sores herpes?
Yes.
Now, if I have a cold sore that is considered HSV1 orally, I can pass that on to the genitals, but how do we get HSV type 2 out of this?
So same way. So whenever you make contact on any part of the skin, you have the risk of transmitting the infection to anywhere on the body. So if you have a cold sore around your mouth, and you touch it with your finger and then touch your eye, you can expose your eye to the herpes virus and then subsequently develop herpes in your eye. Mm-hmm. So when you have oral labial herpes and you perform oral sex on someone, you can transmit herpes type 1 to the genitals, and vice versa. If somebody has sores in their privates, herpes type 2, and has an oral sexual exposure, they can then contract genital herpes on their face or their mouth.
Okay. And given that herpes is so common, and we're talking specifically about herpes type 1, herpes type 2, why is it considered an STD if, just like you just mentioned, I could touch my lip and then touch my eye, and now I have eye herpes? So it's skin-to-skin contact. But why do we consider it to be a sexually transmitted disease most commonly?
Well, herpes type 2 is commonly considered a sexually transmitted disease. Herpes type 1 is not necessarily a sexually transmitted disease, especially since there are a lot of children who can develop cold sores. And you can develop cold sores anytime in life. You know, if your parent has a cold sore and they kiss you, then that transmission will then make you positive and possibly make you have a cold sore in the future. We all know that's not a sexually transmitted encounter, and so the most commonly referred to sexual encounters are having to do with HSV type 2, herpes type 2, which most commonly produces the sores in the privates.
Okay, and is there a real difference between the two?
No, there are subtle differences between the two, but only a biochemist or someone with specific viral testing would be able to tell you exactly which virus was one or the other. Clinically, you can't tell the difference. Okay. The sores of herpes type 1 and the sores of herpes type 2 look indistinguishably the same.
Okay. All right. So you're saying that someone who's doing the research or looking at it under a microscope can tell, okay, these are two different strands of herpes. So why do we even bother differentiating between the two? Is that just for like peace of mind or what?
I think it has to do with probably a social norm or a social taboo. If we lump the two together, And I know many children who have cold sores. We don't want the social stigma of infections affecting the privates to be lumped in with infections infecting the lips of our children.
Okay. And so are we able to look at someone and just tell, oh, that's herpes? Like if I see someone that just has some redness around their lips, is it safe to say that that's herpes, or is this something that needs to only be confirmed through testing?
Yeah, it is a clinical infection, so you can tell by looking at someone's sores if it's highly likely to be herpes. And typically, it's somebody with experience and medical clinical training that's going to make that decision. Once you've seen many cases of herpes, you are able to recognize the pattern and the typical look of the sores that make it obvious that it's herpes. So what we're looking for is a cluster. So not just one bump, not just two bumps, but a cluster of sores that originally start as red bumps and then develop clear blisters or vesicles on top of them. That vesicle or blister will then pop, and you'll develop a painful open sore underneath that will then scab over and dry out. And we've all had chicken pox, or at least prior to the vaccine, everyone had chicken pox, and everyone's familiar with the look of typical chicken pox infections. And chicken pox is one of the herpes viruses in the herpes family, and those sores look very similar to genital herpes. But yes, once you've seen herpes sores, know what they look like, know what to look for, you can then look at the next one and determine that yes, it's very likely to be herpes.
Okay. And if herpes goes untreated, can it potentially cause harm, or could it be fatal?
Herpes in general is not going to be fatal. Now you can develop some infections from herpes. So, for instance, if a baby is born and part of the birth process exposes the baby to herpes, the baby can develop herpes in the blood, herpes in the brain that can actually kill them. So you can't say that herpes is not life-threatening, but for most adults, herpes is not life-threatening, and in general causes painful sores and lesions on their body that are socially uncomfortable and slightly physically uncomfortable, but don't typically cause anything other than just isolated sores.
All right. And is this something that just do the symptoms just go away, or is treatment mandatory? Like if let's say I'm having an outbreak where sores are visible and pain is present, am I able to just muscle through it and eventually just the blisters just go away and the pain goes away, or do I have to take medication for it?
Yeah, typically the sores will go away on their own. They last anywhere between 10 days and 3 weeks, and they go through the process that I previously described. If you take medicine for these sores, and you start the medicine as soon as possible, your sores will resolve much more quickly than without the medicine. But either way, your sores will resolve on their own.
Okay. And how do we know for a fact that we have herpes?
Well, the only way to know for sure with absolute certainty is to be tested. So if you have sores with these clear fluid-filled blisters, I can actually wipe a cotton swab on the sores, break open some of the blisters, and take some of the fluid that's contained within those blisters, and then send it to the lab, and the lab will give me a definite positive confirmatory test that you have evidence of herpes in this swab. The other way to test for it is to have a blood test where we test for the antibody response, and the antibody response is part of your immune system's response as a subsequent reaction to your infection of herpes, and that process takes a week or two for these antibodies to develop. So if you develop a sore on day one, if you check the blood, you will not have an antibody response to that sore. But after 2 weeks, you should have an antibody response, and we would be able to tell that you had possibly been exposed to or had herpes infection based on an antibody presence in your bloodstream.
All right. And then, well, real quick, let me backtrack. So we talked off of the podcast, we talked about the healing process or how our bodies fight the virus. Can we go back through that? I have the cartoon analogy in my mind, but let's give yours first and then I can dumb it down for anyone. So I have a herpes outbreak. How is my body fighting it off naturally?
Sure. So the main component of your immune system are your white blood cells. White blood cells produce a antibody or make an antibody that's directed specifically to the virus. So once we localize and identify the virus in the bloodstream, the white blood cells will produce an antibody response specific to that virus. The antibodies will be secreted into the serum of the blood and will bind to the virus, which makes it easier for the white blood cells to eat and kill the virus and eliminate it from our bloodstream.
All right, so the dumbed down version I gave, and you can just tell me if this is right or not, is the white blood cells essentially see the virus and they like jump onto it as a blob and then transform to this like merged virus white blood cell thing that can go on and fire off some merged form of what the white blood cell does and what the virus does and uses that to combat the virus.
Yeah, it's just a way, how can we kill this virus? And we do it with a combination of both the white blood cell and the antibody.
Got it. So like the scientific version, well, not scientific version, but like it would be the equivalent of being attacked by a foreign alien or something, and it's an alien invasion, we knock out an alien, bring it back to the lab for research, understand it, and then we're like, oh, okay, this is its strengths, this is its weakness, these are its strengths and weaknesses, here's what we can use against it to keep it at bay.
Correct.
Got it.
Yeah, absolutely.
All right, now, fast forwarding, now that we've gone back and gotten that taken care of, you said that the blood testing, it would take a while before the antibodies show up in your blood. Question about that in particular is with the blood test, if there are antibodies in your system, you have to be over a certain number in order to be considered positive. So the information that I have in front of me is that if your if the antibody count is below 0.90, you're considered negative. And if you're above 1.10, you're considered positive, with that range between 9 and 1.10 being equivocal, which is just a maybe. If I am under that 0.90 antibody count, on the low end, let's say I'm 0.01 for my antibody count, can I still infect someone with the herpes virus?
Well, the first question is, if you have a blood antibody result that's less than the definitive positive on the blood test, are you still positive for the virus? I think the safe answer, the simple answer is, if you have a positive result at any number for this test, that you should consider yourself positive for the virus. Just because you have a small amount of virus in your bloodstream doesn't mean that you don't have the virus. It probably means that you're either at the beginning or the end of your exposure to that infection. So if you just start making antibody to the virus and you measure after the first week and you don't have enough antibody in your bloodstream to be over the 0.9, you have virus in your blood from that virus. You have antibody in that blood from that virus. It's just that you haven't made the full amount of antibody at that time, and so your number is going to be lower than the bottom end of the range. On the flip side, if it's been 70 years since you've been exposed to the virus, and you were exposed and you were positive for antibody your whole life, and you haven't seen the virus in a very long time, maybe your levels of that antibody have dropped down and gone below the range of positive antibody response. And so you still have antibody, but you don't have it in the range. So either way, if you're positive for the test, even if the number's below the official range, you probably are positive for an exposure to the virus. You may not have had a clinical infection at that time.
Okay. And with this testing, herpes is not a part of the standardized STD screening, correct?
It is not.
So why is that?
So a lot of people are walking around that have an antibody to herpes, either type 1 or type 2, and have never had a sore. They've never had a lesion. They've never had a clinical herpes infection. And so to tell somebody that they've been exposed to herpes in the past may not mean they have the virus in their body. It definitely means they've been exposed. It may mean they currently have a clinical infection with herpes, but it just provides some confusion for the patient. So I think the best way to approach these are, if you've never had an outbreak, if you've never had sores, you've never had lesions, understand that it's possible you've been exposed in the past, but you don't have herpes. If you develop sores or lesions, then you should get tested and treated, and your test results at that point will be clinically significant, because now you have something to base the testing on, as opposed to just an asymptomatic person.
Okay. Is that how you typically would present this information to a patient?
Yeah, if anyone ever wants to be tested, we will absolutely test them. It's very easy, straightforward, and simple to do. But the problem is the results can be confusing and difficult to interpret if you've never had a sore or an outbreak.
Okay. And then, so what's the best way, I mean, this may be for doctors listening as well. What have you found is the best way to present this information, given the different emotional responses that a newly diagnosed patient could have?
Whenever you're discussing sexually transmitted infection or disease with a patient, it always carries a great emotional weight. So I think the important thing is for us to think about how the patient is going to receive this information and process the information and present it in a way that is serious, that's deliberate, but that's also calm and couched in a way that allows the patient to receive the information as easily as possible.
I think that's a good answer, because that's kind of what we want to do when disclosing to someone new. You want to be calm. If you're freaking out about it or shameful about it, then that feeling is what the other person who's receiving the information is going to also have. For anyone who doesn't receive that information, that they're newly diagnosed with an STI, well, what do you think that these people should know? If they're not experiencing any symptoms at all, they come in and they're just like, oh, let me get tested for herpes. Like, everything's fine. They don't think they have it. And then you give them this information. Do you feel that it helps more so than doesn't help? Let me re-ask that question, because that was a terrible way of putting it. If I don't have symptoms, I come to you and I go, hey, test me for everything, even herpes. You test me for herpes. It comes back that I tested positive for herpes, and now all of a sudden I'm depressed, suicidal. What is something useful for me to know? Or what resources would you direct me to in order to help me get through that?
It's a big question. That's a lot of information, but the several ways that we should address this are first of all, if somebody comes back with a positive test for the antibodies, so they've been exposed in the past or they have an infection, we should reassure them that if they haven't had a sore or an outbreak previously, and we can go through them and kind of give them ideas as to, hey, have you ever had painful sores in your privates? Have you ever had cold sores? Have you ever had painful red bumps with clear fluids? I mean, kind of describing to them. If they've never had that before, then I think the best approach is to reassure them that this is an incredibly common exposure, incredibly common event, and the likelihood is that unless they're in a high-risk sexual relationship currently, where they might have recently been exposed, their chance of having a sore or a herpes outbreak is very small. Mm-hmm. And they should do nothing different. They should not change their relationships or their interactions at this time. They should wait and observe and watch and remain calm and try to approach this in a balanced, logical way. Now, if they ever do develop any symptoms, then let's treat it with regard to the symptoms as opposed to the antibodies. And at that point, there are all kinds of mechanisms or precautions that can be done in order to protect them and their partners from a further spread of the infection or the illness.
Got it. Now, one of the, obviously besides the pain, the physical pain of having herpes, the stigma is something that people typically struggle to deal with. What can we do to lessen just really lessen the negativity of the stigma?
Well, understand that patients that are newly diagnosed with herpes, you're not the only one that has herpes. There are a lot of people out there, a lot of friends and family, colleagues, neighbors that you know that have herpes, and you just don't know it. And most people with herpes are able to live very happy, full, successful, functional lives, and they're able to have sexual relationships with very little effect or negative outcome. They're able to have babies. They're able to carry on with their lives and work and happiness and do everything that they would have previously done prior to being diagnosed with herpes. You know, the medicine that we have these days for herpes is actually quite impressive. And most people, again, have either zero or a few sore outbreaks their entire life. But if you do develop a herpes infection, we can give you medicine that'll shorten the duration of the infection and certainly also shorten the severity of the infection. But patients who have frequent outbreaks or more outbreaks than just a handful of their lives, we can even do chronic suppressive therapy so they can actually receive the medicine every day if needed in order to keep the herpes away.
Okay. And then one of the things that I wanted to ask you as well was, as far as vaccines are concerned for people who currently don't have herpes, given it's common as it is there a vaccine currently in the works that you're aware of or being worked on, or anything that can cure herpes at all?
Yeah, there's no vaccine for herpes currently. There may be some research in the works for trying to develop vaccines for the future. Certainly, if we find out any information that will make it available to patients, we'll educate patients at that time. But at this point, prevention is the key. Once you have the infection, treatment is very successful, and avoidance is the main goal at this point.
Okay, and then I think that was everything that I had. I mean, I can ask questions for days, just given the number of people that I've spoken to. The questions that I asked you were just some ones that different people have shared their concerns for, just how the virus is contracted. There's one more. So viral shedding. Herpes, obviously, directly skin-to-skin contact. Can I pass herpes from an object to a person?
Well, typically it comes from human to human. You're not going to get herpes from a toilet seat or a sink in a bathroom or a door handle. But if you touch the herpes rash, there is a high likelihood that you can then transmit that rash to whatever was touched. So the key here when we talk about sexually transmitted diseases, and we haven't mentioned this previously, but it needs to be mentioned probably 100 times, use condoms. Condoms and latex barriers are very effective mechanisms to prevent not only the infection and transmission of herpes, but all of the other sexually transmitted diseases that we refer to, as well as preventing pregnancy. So condoms are the key to avoidance and limiting the transmission. Now, if you do have a part of the body that comes in contact with another part of the body that's infected or previously is infected, and this asymptomatic shedding is certainly an issue, you can be exposed to and have a successful transmission of herpes even if you're wearing a condom. So, people get genital herpes, not just on their penis, but anywhere in the private area.
So we're talking like the growing area,
Correct.
or between the legs. I don't know what the body part is called. But
Correct.
Anywhere there around the anus,
Correct.
things like that.
Any place that makes contact with the virus certainly is susceptible and possibly going to get a new rash or a new exposure in that location.
All right. So if I'm someone who thinks I've been exposed to herpes, what do you recommend I do immediately?
So if you've been exposed, there's not a ton you can do. But if you ever have a question or ever are confused and don't know what to do, come and see us. We're happy to help you. Certainly, if you have a new sore, a new bump, a new rash that you're worried is herpes, the sooner you come see us, the more likely we're going to be able to give you a successful treatment of a medicine to suppress and treat and make this new rash or new infection go away. Education is a big part of what we do. We talk with the patients. We tell them what we think the infection is, how we're going to treat them, what the issues are for both now and in the future, and we give you guidance as to how we should handle this going forward. We're able to handle all the medication dispensing and the education and the treatment and the resources that you need for both the suspicion but also the infection.
Perfect. I said I wasn't going to sit here and do like a Q&A style thing, but that just worked out that way. This has been a very, very informative conversation, and I want to ask you now if there's anything that I haven't asked you that you feel is important to this episode or this show topic at all.
I think the topic is fantastic. I think it's important to talk about these issues that are real and get them into the public eye, educate as many patients on this as possible. We certainly have not done a good job if patients don't know about these infections. Mm-hmm. So the more patients know, the better they're able to make decisions that protect them and their families, so they can have a successful, happy, healthy life. I think all of these sexually transmitted diseases are by definition preventable. Obviously, condoms are the way to go. Early treatment is absolutely available and easy to do, and I appreciate you bringing these conversations to the forefront to make sure that we're discussing them, educating patients, and making this world a better place.
I appreciate that, and you and I got to speak about this before, but for anyone who's new listening, one of the reasons that this podcast, Something Positive for Positive People, was started was because I have herpes, and I was in a conversation with someone who also had it, and when she was newly diagnosed, it just kind of rocked her world. Everything was going well for her, and eventually she just needed somebody to talk to and wanted to get feedback from a male perspective because she was seeing someone who was very indifferent on it. And it's like the biggest concern that I've seen people have when they're newly diagnosed is who's going to want to be with me now that I have herpes. And in this particular case, her significant other was like, oh well, it's fine. However, she confessed to me at some point that she had contemplated suicide, and when that happened, I began to hear it again and again in different chat rooms, different forums where people who are newly diagnosed contemplate suicide. And one of the things that I wanted to get out there was, hey, this isn't a big deal. Like, this is how I'm living. It's manageable. It's treatable. But my word wasn't good enough. So one of the things I wanted to do here was just get as many stories out there as humanly possible and get medical professionals on here to say it's not that bad, it's treatable, it's manageable, it's common. So that's what I'm hoping that we were able to accomplish here with this episode with Dr. Bruckel here at Total Access Urgent Care. How can people find you here in St. Louis?
Our whole goal is to have an office in every neighborhood here in St. Louis. But if you're not sure where we're located, you can go to our website, which is www.tauc.com. That's totalaccessurgentcare.com, and find the location nearest you.
Perfect. Thanks so much for your time, Dr. Bruckel.
Nice to meet you. Thanks so much.
That's us shaking hands at the end. That concludes this episode of Something Positive for Positive People. Please, if you haven't already, review, rate, like, share the show on whatever podcast player you listen to. I can be found on social media at H on my chest. Till next time, stay positive.